Hi, it's Nicole Jones from the Physio Crew, and I thought I'd just talk you through a little bit about a patient I saw who had a brain surgery and how she recovered. So I saw her when she was sort of in her 60s, and she originally had the brain surgery when she was 20. So it'd been a really long time that had passed, and she hadn't had access to physiotherapy. She actually lived in a different country, so it was very different than here. But I just wanted to talk you through some of the exercises that I did to help her, and how, as a physio, we sort of broke down the patterns of her movement and how we helped her. So this particular lady, she had what we call a flexor pattern, which means that you get internal rotation of the shoulder, and I'm just going to stand up a minute, and this sort of with your arm, so you get rotation inwards with your hand, and then close to the body, and the shoulder can come sort of down, and it can also sublux, so it can drop down because the muscles aren't controlling around the rotator cuff to hold the humeral head where it should be within that shoulder joint. So with her, I didn't have any neuro experience really at the time. I'd been working a lot in musculoskeletal, so I'd obviously done my physiotherapy degree, but I was very, very junior when I was seeing her. And so the first thing that we started to get her to do was to try and work proximally. So when you work with someone who's had something like a stroke or is having this hemiplegia, the weakness on one side, which can be due to a stroke, it can be due to brain surgery as well, but her particular presentation looked very much like a stroke. Her balance was affected, she had weakness on one side, and so the first sort of assessment that I did was looking at how she was able to talk to me. Was there any communication problems? Did she have any problems in her neck? And then started looking a little bit more down the arm globally. And there's kind of two different ways that you can look at things neurally. You can try and get people to recreate the automatic part of their brain. So you can look at, for example, getting them to reach for a cup, so they just automatically think about it, try and initiate those muscle pathways and brain pathways that you were using before. Or you can look at really trying to work on the stability muscles that are close to the spine, so proximal, and then work distally and further away. So I actually did a combination of the two approaches with her, but I just started by getting her just to squeeze her shoulders back, looking at trying to change, so as she was internally rotated, trying to work on the muscles that rotate the shoulder backwards, and then looking at trying to get her to bend and straighten the arm. So she had a flicker in her hand, so if you get flicker, then that is saying that there is still a signal going from the brain all the way down to the muscles. So I knew that there was potential. If someone is unable to move their hand, unable to feel it, and there's no flicker, then the potential is less, but still worth trying these exercises. And what I would do is I would help her, because her hand was fixed, I would help her to open the hand, put a towel within the hand, lie her on her back, and then get her just holding the towel to move backwards. Now what tended to happen is she couldn't control it, so the towel would face inwards. Now I got her lying on her back, trying to keep that towel just straight. So first of all, I just got her to rotate the hand out and then back. Rotate it out and then back, and then gradually getting her to actually move through the range of movement. So as you get her moving through more range of movement, she has to control the shoulder in a wider range, and that's more difficult. So on a very simplistic form, when you're thinking about physio, if you've got a load that's very close to you, so if you're holding something heavy close to you, it's much easier than holding it further away. So when we're looking at the education of muscles, what we want to do first of all is start with a short lever, so that might be with the arm bent, or it might be actually that you're just stabilizing, and then you start making it harder by putting weight sort of close or further away, and that can really help to improve the stability around there. Now in terms of her hand, I would get her first of all squeezing and then opening the hand, and I would even put a bit of